Hi, my name is Dr. Aaron Boyce, a licensed psychologist and licensed specialist in school psychology in the state of Texas. I've been working for Cy-Fair Independent School District in Northwest Houston for the past 6 years, providing comprehensive psychological services for students with a variety of disabilities and age ranges, with a primary interest in younger children or students with intellectual and/or developmental disabilities such as autism. Prior to my work at Cy-Fair ISD, I worked in a variety of settings such as hospitals and community mental health agencies. Today, I'm going to discuss some of the challenges and considerations for working with students with a dual diagnosis of both intellectual or developmental disabilities and significant emotional or behavioral concerns. At Cy-Fair, I work at multiple different campuses, including one specialty campus that serves students with intellectual or developmental disabilities, as well as significant challenging behavior. These behaviors include externalizing behaviors such as physical aggression, spitting, and biting, to automatic or sensory behaviors such as self-injurious behavior. The classrooms at the campus are self-contained and have a very low student-to-staff ratio, oftentimes one-on-one. Within this specialty campus, I collaborate with a variety of staff and related service professionals, including occupational therapy, physical therapy, music therapy, and speech-language pathologist. All of our students have intensive behavior intervention plans and typically have a variety of related services. There are a multitude of strategies or techniques that we use to either prevent or reduce challenging behavior. These are oftentimes included in some capacity within our behavior intervention plans. Because of the challenging nature of the behaviors, our campus is much more likely to complete a more in-depth analysis of the function or cause of behavior. These procedures, called functional behavior assessment, are instrumental in determining intervention strategies because if we hypothesize the incorrect function, this can lead to an increase in challenging behavior as opposed to a decrease. Additionally, because of some of the unique challenges the campus has, we oftentimes have to rely more on antecedent or preventative techniques as opposed to consequence strategies. I'm sure that many of the listeners are at least somewhat familiar with consequence strategies, such as providing reinforcement for desirable behavior. Due to some of the unique challenges of our students, combined with the intensity of the behavior, it is oftentimes more beneficial for us to focus on antecedent strategies. This is not to say, of course, that we do not provide high levels of reinforcement. In fact, my guess is that the reinforcement we provide at our campus is oftentimes at a much higher rate than a typical life skills classroom. In thinking about some of the strategies that we use, there are 4 things you should consider. The first, and probably most important, is making learning fun. One strategy that we use is to provide an enriched environment. This is a strategy where staff provide access to lots of highly desirable items or activities. By providing this frequent access to reinforcing activities or items, it is oftentimes powerful enough to compete with challenging behavior at school. The second thing you should consider is making a schedule that is predictable. We do this by utilizing a highly structured environment with very frequent breaks. Our students learn quickly that if they are able to work for short durations of time, they will have access to breaks or other desirable activities. The duration of the work or the break depends on the presenting behavior and unique student needs. For example, a student with severe self-injurious behavior, it would not be uncommon for the student to work for 5 minutes before taking a break. The third thing to consider is making learning visual. By providing frequent breaks with visual support, this leads to an increase in predictability and therefore reduces the likelihood of challenging behavior. Many of our students utilize a visual schedule to provide a visual reminder of their day or upcoming task. Some of them also utilize a token board to demonstrate the amount of tasks required before taking the next break or access to reinforcement. It is important to consider the individual needs of your students and how much visual support they might require. First, then, is a strategy in which students are provided with the expectation up front, such as first we do math, then you get a break. First, then, can be provided simply as a verbal reminder or combined with visual support. First then strategies are a great way to combine the antecedent strategy of setting up expectations with reinforcement strategies for appropriate behavior. The fourth and final consideration is making the environment consistent. Within the specialty campus I work at, consistency is oftentimes the key to success. It is great that we put detailed behavior plans in place, but if they are not implemented with integrity across staff, it will oftentimes lead to failure. In thinking about the strategies mentioned, think about the different staff who will be using them. For example, you should ask yourself questions such as, is everyone using a token board the exact same way? Are we all setting the same expectations for the student? Do we all agree on what is appropriate versus inappropriate behavior? Getting everyone on the same page is the foundation for an effective behavior plan. To help with this, staff can do frequent check-ins with each other regarding their definition of behavior or how they respond when a student engages in a specific behavior. Think of this as a recalibration to make sure everyone is setting the same expectation and structure for your students. So, what is my role at the specialty campus I work at? My involvement is primarily as a consultant. Many of the students receive what we call related services through an IEP and, more specifically, psychological services as a related service. Within this role, I consult with teachers, I work with caregivers, and help staff with documents such as behavior intervention plans and general problem solving for challenging behaviors. I also complete comprehensive psychological evaluations and work as a liaison between private professionals, such as behavior specialists or pediatricians, and the campus. I sometimes complete functional behavior assessments, as mentioned earlier, to help identify the cause or function of the presenting behavior. There are also a small number of students on my caseload who receive counseling services. When working with students with both an intellectual or developmental disability and significant challenging behaviors, I tend to use strategies that are more concrete as opposed to abstract. This could include diaphragmatic breathing, where I teach students deep breathing from the diaphragm as a coping technique, or behavior activation, which is having the student actually do the things that make them feel better, or emotion identification, such as identifying emotions on a thermometer. After these strategies are taught, I then work with teachers or other staff to prompt the use of those strategies in the classroom to encourage that generalization. In taking all of these strategies together and thinking how we can support students with both intellectual or developmental disabilities and significant emotional behavior concerns, you could ask yourself the following. How can I make the student's daily routine and expectations as predictable as possible? How can I make sure that all adults who work with the student are implementing the plan consistently? How should I tailor my intervention or strategies to the student's individual needs? And for those of you who are school staff, what supports are we using that caregivers could also use at home? And thinking about the last point, if you find visual support that have been effective at increasing predictability and reducing challenging behaviors, provide it to the caregivers and encourage them to use it as well. I have had many teachers make copies of the visuals they use and even practice the use of these visuals with the caregivers to help with the generalization of skills. I hope that this has at least been somewhat helpful in considering some of the ways we consider the dual diagnosis and intervening on significant emotional behavior challenges. This kind of work can be extremely rewarding, especially in consideration of preparing the student for potential employment or other post-secondary opportunities. This really is preventative work and trying to set up the student for success the rest of their life. Remember, effective strategies: 1, make learning fun; 2, create an environment that is predictable; 3, make learning visual; and 4, are consistent.